Welcome to the Maternity Mentor. Today we will be talking about the top 10 things you can do to reduce the risk of having a vaginal tear during delivery. Stay with us. Hi, I'm Samantha. I'm a board-certified psychiatric nurse practitioner. I have over 13 years nursing experience working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC, perinatal mental health certified, and maternal newborn nursing certified. Tearing during delivery is one of the biggest fears a woman has. Let's explore the top 10 things you can do to prevent tearing during delivery. Vaginal tears are very common and occur in approximately 90% of all vaginal deliveries. Almost all tears are mild, but they still can be quite difficult to deal with. When the baby's head crowns during the second stage of labor, it stretches the skin between the vagina and the anus, otherwise known as the perineum. If the skin is not stretchy enough, a tear can occur. Risk factors that increase the likelihood of tearing include having your first vaginal birth, having a big baby, being of Asian ancestry, increased weight gain during pregnancy, a long pushing stage or second stage of labor, shoulder dystocia where the baby's shoulder gets stuck behind the pubic bone, your baby being in a posterior position, and an assisted birth including forceps or the use of a vacuum. It is very unlikely to prevent a tear, but you can do things to reduce your risk. First up is making sure your body is healthy during your pregnancy. Nutrition is a key component to this. Proper nutrition includes a diet full of healthy fats, especially omega-3 fatty acids and protein. Both support healthy muscles and skin. Drink plenty of water so your tissues don't dry out, which reduces elasticity. Vitamins E, C, and zinc help provide the nutrients your perineal skin needs to be stretchy during labor. Other key elements are movement and exercise. Exercise helps improve circulation, which improves skin elasticity. Finally, having orgasms helps increase blood flow to the vagina and perineum, which improves tissue health. Next up is strengthening your pelvic floor. The pelvic floor muscles help to move the baby down the birth canal. Stronger muscles can help to control the speed of descent, can give you the ability to stop pushing if needed, and have greater potential to relax when needed. The best way to strengthen your pelvic floor is by doing Kegel exercises. This is a series of movements where you contract and relax the muscles inside your vagina. When practicing your Kegels, it is equally important to practice the contracting as well as the relaxing, because there are moments where relaxation will be key to preventing a vaginal tear. Before we continue, please remember to hit the like button and subscribe so you can get our latest content to have a happy and healthy family. Now, let's talk about perineal massage. Perineal massage is a technique that has been shown to not only reduce tearing, but also to reduce pushing time and pain during labor, as well as improving APGAR scores of babies. It also reduces your risk of getting an episiotomy, which carries its own complications. With your healthcare provider's approval, you can begin daily perineal massage during your 35th week of pregnancy and continue until your baby is born. Some tips for perineal massage include having your partner help because it can be challenging to perform perineal massage alone. Take a warm bath or apply a warm compress to the perineum, which helps the muscles to relax and increases circulation. Make sure your nails are short to reduce the risk of tearing the tissue or causing pain while massaging. And using lubricant while massaging, like vitamin E oil, almond oil, or olive oil. To perform a perineal massage, start by getting yourself into a comfortable position and using pillows to support your head, back, and knees. Using clean hands, you're going to take your thumbs and place them inside the vagina on the outer edge and then press towards the anus and the sides of your vagina. Hold the thumbs in place for 1 minute. You should feel a stretching or burning sensation, and you should breathe through any discomfort. It should not be painful, and if it is, you should stop. After this, you can use one thumb to perform a U-shaped massage on the edge of the vaginal opening. Finally, you can massage the outside skin in a circular motion. The whole process should be no longer than 5 minutes in length and can be repeated daily. The position you give birth in makes a big difference in whether you will tear or not. Laying flat on your back with your legs held up in stirrups is called the lithotomy position. This position reduces the size of your perineal floor and places pressure on the perineum, which increases the risk of tearing. The best positions for delivery are on your hands and knees, lying on your side, or standing, sitting, or kneeling while leaning forward and being supported by your partner. Ultimately, when the time comes, whatever position you are instinctually drawn to is the one you should try to use and comes with the least risk of tearing. One side note, squatting and kneeling while upright can stretch the perineum sideways and may increase your risk of tearing, which is why leaning forward is very important in these two positions. Our next tip to minimize your risk of tearing is to consider having a water birth. Warm water promotes relaxation, which can help ease the passage of your baby through the birth canal. Additionally, warm water softens the perineum and allows for better stretching. This goes along with our next tip. If you choose not to have a water birth, be sure to use warm compresses on your perineum while pushing. The warmth increases circulation, which reduces pain, and dilates the blood vessels, which helps them to relax. This is one of the most effective ways to reduce your risk of tearing. During the pushing stage of labor, strong pushing contractions will occur that move the baby out without the woman pushing or bearing down. This is called the fetal ejection reflex. When you feel the urge to push, it is better to resist this urge. Pushing tenses your pelvic muscles and speeds the baby's descent. Instead, focus on breathing and trying to relax your muscles, which helps slow your baby's descent. As the baby's head reaches the perineum and it stretches, you may experience the stinging sensation called the ring of fire. This sensation sends a signal to your brain to slow down even further and allows the perineum to stretch properly, permitting the baby's head to pass through. This can be a very intense sensation, but it will only last for a few seconds, and these seconds can be the difference between tearing or not. Our next tip is to avoid vaginal examinations during your labor. Having 5 or more vaginal examinations increases your risk of having a severe perineal tear. Ask your provider about the ability to limit the number of examinations you need. Another tip is using sexual arousal during your labor. Sexual arousal has been shown in research to reduce the risk of tearing due to the vaginal changes that occur. These changes include extra lubrication, vaginal wall thickening, and increased elasticity, which all aid in a smoother delivery. Our final tip is to find a provider that will be willing to perform a hands-on vaginal delivery. A hands-on birth is when your provider supports the perineum while your baby is being born. This technique assists in having a slow and controlled birth, which reduces the risk of tearing. Hands-on birth is only used for a short time but can be extremely effective. When selecting your provider, also be sure to ask about their episiotomy rate. You want a provider with a low episiotomy rate because episiotomies increase your risk of severe vaginal tears. Vaginal tearing can be stressful and cause you to have a more painful recovery from birth. I hope this has given you some tips to reduce your risk of having a vaginal tear. Please share your comments and let us know what topics you would like to hear more about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.